Tonight, we are talking about something called andropause. So, if you've never heard of it, that's okay. You're going to learn about it right now. But andropause is a men's health based topic. If you did not know, June is Men's Health Awareness Month. So, that is why we are going to focus on this topic. So, andropause is pretty much the male equivalent of menopause. But there's some caveats to that statement I just made. One, we know that menopause with women tends to have more of an abrupt type of occurrence. With andropause, we know that this is something that occurs a bit more gradually. So usually sometime around the age of our 30s or 40s, men start experiencing about a 1% decline in testosterone. Now, some men may notice some symptoms with this slight decline that they have, but most men won't notice symptoms immediately. They'll start experiencing symptoms closer to their 50s. Women, of course, will begin having symptoms much earlier than that, with the typical onset of perimenopause occurring somewhere between the ages of 35 to 45. So there are some similarities as far as the time frame in which these sex hormones begin to decrease, but there are some major differences, with the biggest one being that the testosterone in men starts to decrease and is more gradual compared to the drop and decrease in estrogen in women. So when we talk about andropause, you may be surprised to find out that men can experience some of the same symptoms that women get a bad rap for, such as having mood changes, decreased libido, those different things, and even some mental health concerns. So if you're noticing these types of changes, you want to have a conversation with your provider, because it can be a sign of andropause, but it also can be a sign of something else that is going on within your body. As testosterone levels start to decrease, we notice that muscle mass and bone density in men is also impacted. True for women as well, but remember, the focus today is more so speaking about men. So when the testosterone starts to decrease and men begin having decrease in muscle mass and bone density, some men report feeling more fatigued with certain activities, not being able to do things that they were doing before, noticing that it takes longer to recover following physical activity and workouts. And some men also report increases in pain, especially at the joints, muscular tendon pain. So think about things such as like rotator cuff injuries, knee pain, those different things. Because testosterone in men can also help with mobility, when you think about how the joints work and how they can be self-lubricating in certain instances, and also how it can impact the pliability of certain tendons and ligaments, the decrease in testosterone can allow for some men to become and feel more stiff. So mobility is going to be important as you are aging men, so that way you can help protect your body and minimize the stiffness that we typically expect to occur. So if this was the first time you've heard about andropause, there might be some reasons as to that. One, because a lot of people don't even know the name exists. We typically just say, oh yeah, as you get older, testosterone starts to decrease. But also, in addition to that, as we age, and we know this is a natural process, we know that there are other things that we become at higher risk for, such as cardiovascular issues, arthritis, in some cases, memory changes as well. And at times it can be hormonal based. At other times, there can be another underlying issue going on. So never just discount or completely eliminate the hormones without having proper assessments done. So if you assume that testosterone is decreasing and causing those symptoms, and that there may be some help that you can do something similar to what we would have as HRT for women, you're correct, because HRT does exist for men as well. And it exists usually in the form of providing testosterone. Now, it's important that I tell you that if you are a young, healthy male, then taking extra testosterone itself can be harmful to your body long term, because it can impact things such as your fertility and also reproductive health. Okay, so keep that in mind if you are a healthy young man. Now, as you start aging and you start noticing different changes with your muscle mass, bone density, weight gain, especially more adipose tissue that tends to be gained, you start noticing that you have a decrease in libido, whether it be erectile dysfunction, mood changes, then yes, you may want to talk to your provider to see if you are a candidate for testosterone. And that's a conversation for you to have specifically with your provider. And I want to emphasize that, because we do know that historically, especially in certain communities with weightlifting and bodybuilding, that there are ways to get certain types of androgens, hormones itself, that you can use to try to help, bulk up. But you want to make sure that you're going through this process in an appropriate manner. And testosterone may be a solution, but it may not be the best solution for you. So have a conversation with your medical provider. Now, on the physical therapy side, you may be wondering, what in the world can a physical therapist do to help a man who is navigating andropause? Well, earlier you heard me mention that it can impact your musculoskeletal health. So think muscles, joints, bones. It can impact your cardiovascular health. So think about things such as, of course, how well your heart is pumping, but also think about your blood pressure as well. So when we think about just those two categories, physical therapy can come alongside to help enhance how a man is able to progress through this phase and even manage this phase. Why? Because we can promote proper exercises to improve and maintain mobility that's there. But we also can work on appropriate strengthening and dosing because we know that tendinous-based injuries can occur during this time. And we want to make sure that if an injury does occur, that one, we're allowing and rehabbing properly, but that we're also strengthening that muscular tendon junction so that way long term you will be able to maintain that strength. So, very basic, you want to exercise. Yes, you want to do resistance training. In resistance training, loading the muscles will also help you to load the bones. And you heard me mention that andropause can allow for the bone density itself to decrease. So, you want to make sure that you are taking the time to do resistance based training. Now, when it comes to the cardiovascular health, we know that, of course, cardio-based exercise, so exercise that is more aerobic, where you're actually utilizing more oxygen, tends to be a lower intensity over a longer period of time, that can have a huge impact on your heart health, on your pulse, on your heart rate, on your blood pressure, on those different things. So we know that it also can help minimize your risk of stroke. All of those things are related to your cardiovascular health. So when managing it, you want to make sure, in addition to doing resistance training, that yes, you're also doing aerobic based training. The current recommendation for the CDC across the board for both men and women is you want to try to aim for 30 minutes of moderate level intensity exercise at least 5 days a week and 3 to 4 days of strength based training. Now, depending on the type of job that you do, I'm going to be honest, my personal preference is that you may need more than that, especially if you have a job that is more sedentary. So even throughout the day, you want to make sure that you're getting up and that you're stretching because we know that individuals who spend more time sitting, that they're at higher risk for having tight hamstrings. And remember, you get stiffer as you get older. So if your muscles are getting tight, your joints are getting tight, that stiffness itself has nothing to help combat it if you're not moving. So if you have a job where you're sitting a lot, you want to make sure that you are standing up, walking around, and taking the time to stretch. So when it comes to strength training as well, we know that as we age, our strength decreases. And for men, they normally can maintain their strength for a longer period of time, but are usually in their 50s to 60s is when they start noticing significant strength decreases compared to where they were before. And for some men, this can be extremely debilitating because they feel as if they don't have the same capability they had before, and it may even impact their ability to perform functional based activities, such as simple things such as getting on and off the toilet, being able to navigate stairs, being able to get in and out the car. Think about those activities because when your muscles become weaker, your joints become stiffer, your balance can also be impacted. So as a physical therapist, yes, we're going to promote you doing strengthening, making sure you're getting a resistance training. We're going to promote you doing aerobic-based activities. And we're also going to promote the importance of balance because one thing that you can do to prevent injuries, especially as you age, is do everything you can to minimize the risk of falling. But even then, if a fall does occur, if you have the strength that you need, then hopefully you'll be able to recover from that and get up off the ground, something as simple as that. But unfortunately, with decrease in strength, that's not always the case for all. So when it comes to managing andropause, 3 big takeaways that you want to discuss with someone who is knowledgeable when it comes to maintaining muscle mass and building bone density, improving your cardiovascular health. Go ahead and find a physical therapist to help you navigate those things. You want to incorporate strength training, aerobic training, and also balance training. And you heard me mention that if you want to talk with your provider, depending on the symptoms that you're having as to whether or not hormonal-based treatment would be appropriate for you, you can go ahead and have that discussion. In addition to hormonal-based treatment, you may also want to consider talking to your provider about the peptide conversation that is currently going on. Now, we're still in the process of gaining more research when it comes to peptides, but it's showing a lot of promise when in regards to managing various musculoskeletal-based injuries and also assisting with recovery time. Because remember, with increased age during andropause, it is known that recovery from normal physical activity can take a little bit longer. So physical therapy, talk with them about certain things, and also have a collaborative based approach. So talk with your provider as well to see if testosterone or even peptides are two different options that you should consider as you navigate the normal changes that occur as aging happens. So I would love to have any questions or concerns that you all have, drop them in the comments. If you have different ideas as far as different topics you want to learn more about in regards to how physical therapy is related as well, please let me know. Send a message, drop it in the comments as well, so that way we can make sure that your questions are being answered and that I'm addressing topics that interest you. But until then, make sure you subscribe, make sure you like this video, and please share.